think 2019 was a big year for South Africa. I mean, the Rugby World Cup victory was the cherry on the cake at the end of a long year, you know, the first full year of the Cyril Ramaphosa presidency, an election year. We forgot that we had a general election in May 2019. But at the end of the year, it was a full busy year. And of course, you know, Siya Kolisi holding up the William Webb Ellis Trophy was just a cherry on the cake. So I was enthused, I was happy and you know, needed that rest to get charged for 2020, but enthused about the new year.
After the Rugby World Cup win for South Africa, there was a sense of euphoria in the country. I think South Africans had a difficult 2019. We've had a difficult few years, and I think 2020 was seen to be the year of new beginnings, the year of excitement, the year of unity, whatever that may be.
South Africa had ended 2019 on a high, bringing home the Rugby World Cup, and with it a sense of unity the country was in desperate need of. But nobody could have predicted what was waiting for South Africans around the corner. The country would need that unity, but this time in an entirely different way, to fight a virus spreading its tentacles around the world.
What started out as an illness between co-workers at this seafood market has quickly spread across China and beyond its borders.
It's now been confirmed. We have a person within our country who has tested positive to coronavirus. In the last few days, 3 South Africans have died from this disease.
Volunteers, please do not converge together. Keep your distance.
Families are struggling to make ends meet. Businesses have been badly hit. May God continue to bless South Africa and protect her people.
Originating in Wuhan, China, it seemed like a distant problem initially, far away and intangible as it was.
So in December 2019, doctors at hospitals in Wuhan City in China started noticing this strange type of pneumonia, you know, sort of in clusters of patients that were being admitted to their hospitals. They very quickly realized that this was not, you know, a normal kind of a flu virus or anything like that. They did a bit of checking into it after the, you know, sort of raising the red flags, and they realized that it was a type of SARS virus like we'd seen in 2002. And it was very dangerous. It was affecting people very quickly. They were able to narrow down sort of the origins of this to a food market in Wuhan. But mid-November, this new study came out showing that they had found traces of this new SARS virus in blood samples in Italy, dating back to November 2019. So at this stage, the widely accepted version is that the virus originated in China in Wuhan, but we're really not sure.
COVID-19, the new sinister virus, seemed unstoppable as it began to take hold in country after country. It became a race against time as scientists tried to figure out exactly what humanity was facing and how they could prepare for it.
The source of COVID-19, or SARS-CoV-2 as the actual virus is named, has not been confirmed. We don't know. There is a theory that the virus originated in bats and may have been passed on to humans through bats or even through sort of like an intermediary host known as pangolins. But there's a World Health Organization team still liaising with Chinese health investigators, still trying to figure this out, and most scientists believe that we will never know.
South Africa had now recorded its first coronavirus infected person who had been traveling from Italy.
On March the 5th, South Africa's first COVID-19 case was confirmed. A man who had been holidaying in Italy had brought it home. And from that fateful day, South Africa's future hung in the balance. On March the 23rd, President Cyril Ramaphosa announced a 21-day lockdown, one of the toughest in the world.
The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March.
An ominous atmosphere of fear settled into the lives of South Africans as governments scrambled to mitigate a health crisis of unimaginable proportions.
The message of stay at home and the importance of hygiene must be made more emphatically. The message must be that COVID-19 is serious, but can be defeated. And we need each person to make this a personal fight to save our nation.
Soon it became clear a 21-day lockdown would not be enough. The eeriness of the empty streets would have to continue for some time.
The National Coronavirus Command Council has decided to extend the nationwide lockdown by a further 2 weeks beyond the initial 21 days.
Initially, South Africans were compliant and believed in the wisdom of the lockdown for the greater good. But as time dragged on and draconian regulations were put in place, the mood began to change. Government banned the sale of cigarettes and alcohol, leading to a boom in the illicit trade, losing taxes at a time when the country desperately needed them.
South Africa has had a very hard lockdown, and I think that the data shows or showed quite early on that we were successful in containing the spread of the virus, to some degree mitigating deaths, considering we have the way we live in terms of apartheid spatial planning, etc., etc. And so I think that there was a necessary call for the country to be extra cautious at the time. I do think, however, that the focus became more on the regulations and the power that it gave to politicians and to government officials, and it became less about the pandemic. And so what happened was there was a disconnect between the actual regulations passed in terms of the lockdown and what will it do in curbing the spread of COVID-19. And so what happens is you had an unintended consequence of entire industries really collapsing and, being brought to their knees just because of the sort of blanket bans, instead of sort of understanding why we're having this lockdown, what is the need for it, and that is balanced against the impact it has on people's livelihoods, on the economy, etc. And I think that that's where people became very fed up, because you could go to the store to buy winter clothes, but you couldn't buy summer clothes. It was ridiculous regulations like that where government had bungled up. They really missed the plot in that regard.
When government failed to explain certain decisions around the regulations, that's when South Africans started getting agitated. And it got further exacerbated when the Medical Advisory Committee, we saw tensions bubbling over into the public domain about what was happening between the Medical Advisory Committee, the scientists, and the Minister of Health. So the decisions, the political decisions, did not always accord with the scientific advice that was given to government, and that was not communicated. And that, I think, led to a breakdown in trust between government and the citizenry. And let it be said as well, a citizenry that has been suffering from poor governance over the last 10 years.
Offices across the country emptied as people were forced to work from home to avoid close proximity to their colleagues. Journalists and essential service could still move around freely, but investigating COVID-related stories would prove dangerous.
While I was screaming, he fired a shot. I thought because while I was screaming, I could see that he was gearing up to fire. So I was kind of bracing myself, but then the bullet missed.
I'm media! I'm media!
I ran away again, and then also not too far, and then again I said that I was media.
I'm media! I'm media!
And I was like, I'm media! And the cop who shot at me put down his gun and was like, why didn't you tell us you were media?
Why didn't you tell us first?
I was trying to shout you, I'm part of the media.
What do you want here on the street? It's a media, what do you want on the street?
I want a phone.
I got back into my car and I called my editor and I was like, I just got shot. I recorded the whole thing. And then I started crying and then he was like, please go home and call me when you're safe.
Editors needed to balance safety with covering the news.
Managing reporters out in the field was a bit tricky. Some people who were being assigned to intense trips. I remember one reporter had gone with a health MEC on a hospital visit. And after that hospital visit, the MEC, I think, tested positive and they'd been with the Premier. And so everybody who had been part of that contingent had to isolate and make sure that, I don't think she tested positive, but she needed to get tested. So while she was waiting for her results, everybody was in panic mode. And the thing that we don't realize is when we're in the newsroom assigning stories, it's all about getting the story out. So we need to be on the ground to cover it so that the public knows what's happening in this region in terms of what measures they're taking. But we always slightly forget that once they knock off, they go home, and there are people who also live under the roof with them. And so they're vulnerable to the people that didn't sign up to be journalists, to cover stories.
Running 2 newsrooms remotely was very stressful. Stressful on myself, stressful on the team. News is generally a stressful part of the media. This was heightened. It was heightened. It was, the positives was how everyone bandied together. I think there was a definite strong team bond. Also being aware of people's mental well-being and how do you connect? How do you navigate through this new normal? Everyone's working remotely. You don't have that connection that comes with being in the same space.
The everyday lives of South Africans became almost surreal. The military was dispatched to enforce regulations.
The impact of the coronavirus requires an extraordinary coronavirus budget of around 500 billion rand to direct resources towards fighting the pandemic.
Up till today, 3 weeks into lockdown, nobody of this area that we are standing here right now has received one food parcel.
Die mense gaan nie dood van die virus en die mense gaan dood van honger.
The president's relief packages simply could not reach everyone. It was lives over livelihoods. And the already precarious South African economy was decimated. A job bloodbath followed, and unemployment rates reached a record 30.8%.
It's been pretty devastating. I think the fiscal impact in terms of lost tax revenue at a time where we really actually needed it because of South Africa's massive debt problem, that stands out to me as the biggest crisis that this will trigger. Coupled with that, the huge impact this will have on employment for years to come. I think many companies were struggling in South Africa's stagnant sort of economic environment for many years and considering retrenching workers. And when COVID hit and the lockdown hit, that was the trigger to get them to launch mass retrenchments.
Many who do have jobs are now working from home. This too will impact the property sector.
For starters, we'll see the property sector is going to look a lot different. So in lockdown, we saw offices giving up their leases. More than 11% of all commercial office real estate is standing empty at this very moment, and this will only grow as companies find out that productivity actually don't suffer when your workers work from home, and it's much cheaper on the bottom line. So we'll definitely, in the property sector, we'll see some big changes, and this has massive knock-on effects because the pension funds are big investors in property funds, so we'll see pension funds being hit. But in terms of, we'll see offices converted into flats, for example. I think those are one of the big impacts that we'll see from COVID.
There will be other unintended consequences of South Africa's hard lockdown. Schools were shut for months on end, widening the equality gap even further as those with access to online education were able to keep pace with the curriculum. South Africa's economy began to sputter back to life as Ramaphosa moved the country to level 3 on the 1st of June. And then evidence of COVID-19 corruption emerged. Money meant to mitigate the impact of the virus had been diverted to line the pockets of the politically influential.
I think the COVID corruption was really for me the low point in this entire year, 2020. That we all just want to erase from our diaries, our life diaries almost. I think, bringing together a health pandemic on its own is bad enough, with a concomitant reaction to that, the poverty we saw, the schools that could no longer feed kids. I went to Bontehevel in Cape Town and saw, community members having to feed children who literally took the food to their parents because there was nothing else. And then, to have on top of that, government officials and private business contractors stealing from that money that's supposed to cure people, it's supposed to be used for PPE, protective personal equipment, money that was supposed to go into our hospitals. That was a low point in the national psyche and I think for our country. And I do not think the president is wrong when he says that equates to murder. That crime of stealing from COVID budget equates to murder. And I think it was a turning point also in the president's and the ANC's attitude towards corruption. After that, we saw rapid action against those implicated in these scandals.
The revelations around PPE corruption was probably one of the most shocking stories of the year. We received an enormous loan from the International Monetary Fund to try and mitigate against the impact of COVID-19. Cynics warned ahead of the disbursement of these funds that it is simply going to be stolen. Cyril Ramaphosa, the president, who has been trying to turn around this decrepit ship of state, undertook that it won't happen. But what happened? You know, we saw large-scale corruption around PPE contracts. We saw those connected to the political class using their access to enrich themselves. We saw the president's spokesperson, Kusela Diko, being involved in this. So it reached up to the very highest echelons of this government. And it just shows, I think, exposed the ethical issues that we have in this country, the lack of ethics that pervades the state, that pervades the political class, the ruling and the governing class, that, you know, that they could decide to try and exploit a national health emergency, that they could find it in themselves to see what they could get out of it for themselves. And I think that was one of the most shocking stories of the year. We've become so used to corruption during the course of our day and the course of our lives, and during the course of our work at News24. But I have to say, corruption with PPE in the middle of a national emergency, in the middle of a national health emergency, with people dying, was quite shocking.
South Africans' pride in the government's early response had taken just a few months to dissolve into bitterness and cynicism.
Our initial response certainly was on par with the most advanced democracies in the world. I think Cyril Ramaphosa outshone certainly his American counterpart and his British counterpart initially by being very transparent and open with the public in that speech on the 15th of March, which I think was probably thus far the high point of his career. He spoke with empathy about what lay ahead. He spoke with honesty about the challenges and how difficult it would be, and he spoke with clarity about what government is going to have to do to try and contain this virus. So our initial response was world class. It was certainly way ahead of what we saw in Britain and in the United States. It was the subsequent response that I think was a problem. So our initial response, world class. Our latter response and subsequent management, not so much.
Crucial to government's decisions was the input of scientists. Effective testing became critically important.
Testing for COVID-19 in South Africa is a bit of an unknown. What we do know is that more than 5 million tests have been done to date in both private and public laboratories. But what we are also seeing is that there's a high number of cases that we've missed. There were times during, the peak of the pandemic, really a few months ago, where we were hearing all these things about there not being testing supplies, there not being swabs for samples to be taken, they weren't testing kits, for the actual samples to be processed through these very fancy, expensive machines. So it's difficult to say whether we tested enough and whether we tested widely enough and whether we know what happened really. But what we can say is that we probably have severely undercounted the number of COVID-19 cases in the country. According to scientists who've advised government, our lockdown wasn't effective. So the key thing about lockdown though, which has always been the stated sort of goal, was to give our hospitals time to prepare. We needed time to get more ICU beds and ventilators available. We needed time to get doctors and nurses sort of ready and trained up and rested up to deal with this inevitable surge. So if we look at it from the point of view, whether did lockdown delay our peak in infections to give our hospitals enough time? The initial answer is yes, it may have worked. But because we don't have access to detailed hospital admissions data, we can't say definitively whether the government is telling the truth when they tell us that hospitals were not overwhelmed and we didn't see these massive influxes of patients that sort of left people with no beds to sleep in or no ICU beds or no ventilators. We just don't know.
We will also never be able to predict exact numbers. deaths, positive cases, number of hospital beds needed.
The bottom line about modeling is that it's an inexact science. There is no model in the world that can predict down to the last, sort of number, how many people will get a disease and how many people will die. Those models were used as a roadmap to prepare our health system, to give us an idea of how bad it would be or could be. And if you look at the excess deaths that the South African Medical Research Council have found, which is near 50,000, of that 20,000 are reported COVID-19 deaths. But there is evidence that suggests that those missing deaths, that 28,000 odd deaths that we don't know what people died of, in terms of we don't even know what it says on the death certificate. And what we have done is we've, together with some of these scientists, analyzed that, and we've seen that those deaths happened at exactly the same time that coronavirus cases were surging in various provinces. So there's strong evidence and there's a strong correlation to suggest that we don't know how many people died from COVID-19 in South Africa. But if a high number of those excess deaths are COVID-19 deaths, then that would put our death toll close to 40,000. And that would then essentially match exactly what the model said in May.
News24 quickly realized the complexity of modeling and made it its mission to break it down for readers, making it easier to understand.
I think it's seldom in your life that you get to cover a story like this. I know, comparisons have been made to journalists who covered the world wars, for example, or the 9/11. It's a story that impacts life at every single level, that impacts every person's life. Every single person in South Africa and in the world were impacted by COVID-19. From the way you behave, to wearing a mask, getting used to this piece of cloth on your face, not seeing someone smile or not seeing exactly who you're speaking to restrictions on your movement, restrictions on your working possibilities, having to make way with less money. It is a historical impact on all spheres of life that will continue for many years. I think for us as News24, working in a digital journalism world, this was really a good experience as well in using data and science to tell our stories. We developed a very sophisticated dashboard, for example, where people could see the graphics of how many COVID positive cases there are from the country to provincial to your own ward, to seeing the deaths, to seeing over time how the excess deaths tracked the COVID positivity rate.
And on the front lines, journalists were able to get an insight into the lives of ordinary people battling the invisible.
I'm trying to tell the stories out there on coronavirus. You leave your home without knowing if you're going out there to contract the virus. We are among crowds, journalists trying to get pictures, trying to get shots, different shots of the minister, and we are all just in our spaces, and you just sometimes just get scared that maybe if there's one person in that crowd that contracts the virus rather, then you're in danger. But we protect ourselves. We've been wearing the masks. I just took off my gloves now because I was driving and I was just arrived home, so I took off my gloves. I'm about to take off my mask now because I'm about to enter my home. Until there is a vaccine, we expect this to be our daily lives.
The impact of this virus will likely be felt for decades to come.
COVID-19 has changed our lives in ways that we could not even imagine. I can't even think about what my life was before COVID-19 arrived. Just from, the small stuff around mask wearing and hand washing and social distancing to the bigger consequences of people losing their livelihoods and, the world as we knew it not being the same. For example, sectors like tourism, for example, completely decimated. World economies, sort of crushed. So much has happened. The impact has been, I don't think we even can quantify just yet how much COVID-19 has affected our lives. Some of us have lost family members. Some of us have lost our mental health in this time of isolation and being away from people. I think that for me, COVID-19 has changed the way I worked. It has made me appreciate so much more. It's also made me realize a very sad reality that we cannot be looking up to our leaders for answers, and we have to find those answers for ourselves.
The sad reality is that South Africa, unlike first world countries, may have already been in too vulnerable a state to make a comeback from this. But human connection will never be taken for granted again.
I think it will make us more appreciative of human contact and appreciative of social interaction, which we always just took for granted. But actually touching somebody, hugging somebody will be much more significant, I think, in years to come than it was before COVID. I think, as with all things, the pendulum will swing very far back. So I think instead of insulating people and keeping people within their own borders, there will be this pent-up demand for getting out and, seeing the world. And, this has been a reality check for everybody. Life is short.
For now, though, South Africa remains in free fall.
I know everyone used this word, I'm sure, in this documentary. Unprecedented crisis hit us all, and for the South African economy, just sent us into a free fall that we're in now, where we're expecting the economy to contract by about 8% this year, which will be the weakest performance in over 90 years. So, yeah, this is the economic crisis of our times. Right? So that is how COVID-19 has impacted upon South Africa, just added to our depression.
A pandemic that nobody could have predicted turned our world upside down. Those that are living through it will tell generations to come about the year the world became one because of an invisible virus. A vaccine may be in sight, but just how long it will take to reach South Africans is difficult to predict.
So in the last couple of weeks, two major pharmaceutical companies, international companies, Pfizer and Moderna, have announced that their early trial results show that their COVID-19 vaccines are 90 and 94% effective, which is absolutely fantastic news, because if a vaccine is that effective, that means we could potentially all in the next year or so get a dose of this vaccine and then be relatively immune to COVID and be able to withstand sort of the worst sort of risks of this disease. But we're not out of the woods yet. There's still trials that have to be done. There's still a lot of work that needs to go into researching those things. And then arguably the biggest battle that we are going to have as an African country is actually securing doses of that vaccine for our citizens. So we could only see vaccines being available to community members a year from now. So we're going to still have this COVID running around in our community until that happens. So it's great news, but we can't relax just yet. The vaccine is not going to arrive at your local doctor tomorrow.
The anxiety that so many experienced may take a long time to wane, and whether another pandemic hits again, only time will tell.
Something like this virus that you can't even see with the naked eye can come along and essentially decimate populations and economies the world over. I think it's given us a lot to think about in terms of how life is going to look in the next, 20 to 30 years. What What will be the next virus?